very brief program. Like I said, you are all welcome to this important kickoff being held at a very important place, that is SOS Children's Village, which is very dear to this campaign. A quick reminder of the National Health Insurance Scheme and, of course, the electronic civil registration and vital statistics. We are all aware that in the past, when you go for registration of birth certificates, this is done electronically, or astaghfirullah, this is done manually rather, wherein your information is recorded on books, on papers for many years. But luckily enough, this is set to change now. And that is why it is called the electronic civil registration and vital statistics. It is now going to digitize the whole registration process and make each and every resident of this country or Gambian now in the database called the electronic civil registration and vital statistics. So you can now imagine we will now have our data instead of only on paper, but we will also be able to have it electronically. Thanks to the government and the World Bank for this beautiful initiative. Please give them a round of applause. Side by side, going with the electronic civil registration is also the National Health Insurance Scheme. The National Health Insurance Scheme will also avail Gambians the opportunity to have a health insurance, and it is extended to all residents of the Gambia, Gambians or non-Gambians. Anybody that resides in this country is eligible when you enroll in the NHIS, which is under the National Health Insurance Authority. But like I said earlier, this is just to give you a better understanding. But the message out there should be very clear. Everybody, every Gambian, including from the head of state to every individual, from Banjul to Koina to Kiang to Basse to Buyam to Amdalai, every region of this country, all Gambians, whether you have, whether you don't have a birth certificate, you are all encouraged and you are all asked to go out and register during this period. So it's important that everybody is aware. You don't have to sit and say, I have already got my birth certificate. That is an old birth certificate now. We are now going into the digital age, thanks to the government and the World Bank. Please give them one more round of applause now. Next on the itinerary for the speeches, I would wish to call on the registrar at the Ministry of Health, Mr. Lamin Fati, to make a brief remark on this very important and auspicious occasion. Please give Mr. Fati a big round of applause, please.
Assalamu alaikum. Good morning to you all. This is an opportunity for us to be here on behalf of the Ministry of Health, representing the minister and the entire team who wish to be here but couldn't due to tight schedules. And the permanent secretary also had initially alerted us he will be here to join and grace this occasion, but because of the busy schedule in Banjul, he couldn't be with us. On that, we thank and recognize our partners, Dr. Mail, the World Bank Group, head of the Health Task Force team, also head of the World CRVS, and our host, the director, Mr. Kwame of SOS, the Alcalo, the entire media fraternity, the public and the participants, the service providers, and the general public. It's an opportunity in the life history of the Gambia for us to graduate from manual to digital format. One will say registration is new in the Gambia. No, that's a limited site. Registration had been in existence in the country as far back as 1880s to be specific, 1816, that Gambia had been registering and then offering this vital service to the population. But access to it was a challenge to the entire population. And then also, as time goes by, keeping those records and then retrieving them become a big challenge for both the government and the applicants or the candidates. The statistics also, availability of credible statistics is also a challenge. So with the coming of this digital, it is here to address multiple problems and also have many benefits both to the government and to the candidates. One, it will create a population database geared towards a population register where all the vital events will be captured and stored for reference purposes. And also we should know that registering somebody, you have fulfilled the legal identity. As a statement goes by the then Madiba, he said, some individual in this world will be invincible. And when he was asked, why will you say they will become invincible? He said, they will pass by on this earth and return without a trace when they don't have, there is no record about them. And this happens when you register manually and then the records happen to be lost, and it's not properly archived. Such individuals will be called invincible people, will be called, there won't be any trace. Coming with this digital format, it will enhance the system to create a permanent, continuous, and a confidential record about individuals and give them rights and give them sense of belonging and identity. And then it creates an atmosphere that no one is left behind, no one should become stateless, and the data will be reliably accessible, and it could be shared with the partners for decision-making processes. That's why we want to align ourselves with the National Health Insurance Scheme, which you know that is a vital service, which you know that nobody can go without it. We know that health is indispensable. Providing a document that will give them access to that one is very important in everybody's life. That's why the government of the Gambia, with the support from the World Bank, decided to join this mass registration, giving electronic birth certificates or the registration of that one and the health insurance, making them concurrently at one go. It will reduce the resources that will be used by the government and also the time spent by the applicant. So once you are there, it becomes one-step shop that you can have all these materials given to you. The only information we want to give more is that the applicant should be present at the site of registration, because there is an area they should be present, they need to be captured, including their facial features. That should be taken, facial image will be taken. And if applicants are coming, if they are adults, they need to come with a supporting document. This includes national identity card, a birth certificate, a passport. In the absence of this one, attestation from the alcalo, and infant welfare care for children that are not yet matured. So these are the documents that you need to come. If it's a young person, less than 18, he or she needs to be accompanied by one of the parents or a caregiver. It's a legal documentation, and it has its own legal implications. Birth certificate will be given to all legible Gambians or children born to Gambians or non-Gambians in the Gambia. But health insurance will be given to all residents in the Gambia who stay within the immigration limits, 6 months and above or 3 months and above minimum will be eligible to be given a national health insurance and be served. So we have to know that these are legal documentations. The team will only ask few questions to verify the information given. What we are telling the general public is that any information given here should be credible, because giving false information is illegal in terms of legal documentations. And there are penalties attached to those ones. We are not scaring you, but we are saying when you are coming, be sure that information you're giving are credible and reliable. You don't have to give double information if you don't know yourself. And if you are not legible, don't come forward on that one. But here, our approach is that everybody will be legible. Those who should have the birth certificate will be given, and all will be given health insurance cards. So there is no somebody who will come and go home empty. Everybody will have something to go with. Therefore, we urge every individual, those here today, and then also inform the general public that will be coming and moving from one community to another using IEC registration centers, where we'll be there for a specific period. We are urging every individual to ensure that when they are at your community, if you cannot have this service here today, ensure that the service is that has come to your doorstep, you utilize it at the time they're there. Otherwise, the opportunity given now, if that should go away, you may have to have some implication of cost and time. For example, this registration is free of charge. The government, with the support from the World Bank, is providing the services free of charge. The certificate will be given free, the insurance cards will be given free. But there will be cost implication after this exercise. Obviously, we need to have a user fee to ensure that service continues. So therefore, we are urging every Gambian now to seize this opportunity and avail himself or herself at the registration centers, particularly when they are in your community. You register timely, you give yourself little time because it's a process, and answer the questions they will ask you, the approving officer or the data entry class will ask you. And you organize yourself into group in a mannerly order so that you can have access and then you don't create chaos at the service point. On that note, we thank you all and urge all of you to register timely.
Thank you very much. I'm Jibril Jaju. I'm the Director of Planning and Information at the Ministry of Health.
Can you tell us why
Thank you very much. Over the years, the Ministry has been issuing, since in sense of the Ministry was the institution mandated to register birth and death in this country. And as such, we have been using the manual, the handwritten birth certificate for so long. And this has given us trouble in terms to verify. And then general understanding of registration of a handwritten, a lot of Gambians don't understand. So once they actually received the birth certificate and there are some spelling errors, they will use the same pen and rewrite. And once you rewrite on the writing of the first registration officer, it nullifies your birth certificate. So as such, the ministry has been having issues around the birth certificate and its authenticity. So we decided that it will be important that we roll out an electronic civil registration and vital statistics system that will capture every individual and every Gambian in this country, and the verification of your data will be very apt and simple. And once you actually need to know whether an individual is a Gambian or not, it shouldn't take you long to be able to verify the data. As such, government approves this system for it to be actually launched, so that when Gambians want to acquire their nationality document, it wouldn't be frustrating, it wouldn't be difficult, it wouldn't be back and forth, because the system will be there, accessible to every individual institution mandated by law to have access to individual bio data for identification, like the passport and also the ID card. So this is why we are launching this birth registration process to get every Gambian recorded in the system. This campaign is going for 3 months, but it may be an extended campaign because our target population is the estimated population of this country, and it's between 2.2 to 2.4 million Gambians. And this time, the scale in terms of coverage has never happened before. All the registrations we have seen or we have witnessed in this country from independence to date, I don't think there's at any given time that a campaign has actually targeted the entire Gambia population from 0 to the last, elder passing in this country. So it's big. We may not have fixed timeline, but we are targeting 3 months in the entire process. But we want to reach every community. So it may be extended to 4 months or 5 months during the process. Yeah.
So who are your partners in this process?
Yes. So our partners are the World Bank. World Bank is the funding entity for this project, and with of course support from the Gambia government.